Welcome to the Digital Health and Fitness live studio presented by United Healthcare. I am Dr. Eric Eiting here at CES 2017, and with me I have Morgan Reed. Welcome, Morgan.
Glad to be here.
So Morgan, you're joining us. You're the executive director of ACT, and you just sat on what sounds like a really interesting panel. What did you guys talk about?
Well, what we were doing is exploring how does this age of digital medicine, this age of mobile connected devices, smart supercomputers in everyone's pocket, interface with a dramatic change in how we may get our healthcare. As we all know, the president-elect and Congress has decided to repeal and then replace ACA, or what's also called Obamacare.
Right.
And so a real question is, when Obamacare was first passed in 2008, we didn't have the kind of supercomputer in our pocket that we do today.
Not at all.
So
in fact, Obama was using a BlackBerry,
That's right. So how do we take advantage of this shift in digital capability as we rethink healthcare that ultimately should improve patient outcomes and, frankly, serve to help physicians do their jobs more effectively and hopefully with more happiness.
Yeah, and I think that what's on people's minds right now is that they're sitting there thinking he's probably going to be a deregulation president, he's probably going to be pro-innovation, but he's also promised to drain the swamp. But what does that look like?
Well, I think what's really interesting about the deregulatory president is, in fact, the last 8 years had quite a bit of deregulation in the healthcare space.
Yep.
While ACA was significant in terms of its impact on people from an insurance perspective, at the same time, this administration passed rules that allowed companies to be more innovative through the Food and Drug Administration, or the FDA.
Right.
It clarified rules around cloud computing and HIPAA,
Yep.
and it clarified certain aspects of remote patient monitoring. So we saw some deregulatory or pro-innovation agenda items come through the past Congress. Now the question is, how does the Trump administration carry that forward? And I think the real answer is, it doesn't matter who the president is, we all want the same thing. We want to be healthier, we want to be engaged with our physicians, and the physician wants a better patient who's able to get their medicine in, take it when they need to, and ultimately get healthy.
Right, exactly. I think the point of all of this is, whatever the solution is and however we get there, it has to be patient focused,
Yes, but I think there's one point that we have to remember. Ultimately, the healthcare system is about the doctors like you,
right,
who provide us the healthcare.
Mm-hmm.
We want an engaged patient, but ultimately I need you to make the right decision.
Right.
And so we have to look at, how does big data help to inform you? What drug to prescribe me? What treatment to make a recommendation for? Now, there are a lot of regulatory barriers that still exist, and we are working through something called the Connected Health Initiative to try to clarify that. We're working with university medical centers, patient groups, and industry to try to clarify and come up with answers to questions like, how do we meet privacy and security?
Right.
How do we meet reimbursement?
Yes.
And then finally, how do we know if it works through effectiveness? So what we really see in this Trump administration and moving forward is, how do we answer those three questions for all the stakeholders: patients, physicians, and ultimately the technology industry that builds the equipment we all depend on.
Right, and what's so fascinating too is, even those things that you brought up, what people don't realize is that so many of those were actually the original part of the Affordable Care Act or Obamacare.
That's correct.
It's fascinating. Right, Morgan Reed, thank you so much for joining us.
Thank you very much. Good to be here.
Here at the Digital Health and Fitness live studio presented by United Healthcare, I'm Eric Eiting at CES 2017.